Hey, special episode of the Cannabis Pharmacy podcast, the Cannabis Pharmacy Network podcast. I met this guy, Josh Kent. It's been it's been 3 years now, maybe 4 years. It's been a while. And the evolution of the Pharmacy Podcast Network's dedication to bringing good information from the cannabis world, cannabis medical world, the research world, with our partnership with Joe Friedman, who has been a lead consultant for the state of Illinois' cannabis programs, with us developing the very first podcast on this network about cannabis and its usage in treatment. Our partnership with the Cannabis Magazine network that also had us doing their podcast as well. The CRX podcast was wonderful. So running into Josh Kent with Cannabis Pharmacy Network has been an evolution that we're very proud of in this partnership that we're building, Josh. And I'm so excited to see you. We haven't done that. We don't do these enough. So it's good to be back.
Yeah. Hey, Todd, thanks so much. Always a pleasure to get on and share some of the stuff we've been learning and seeing out here working in the pharmacy world. So thanks for having us on.
We have a dedication to education. We're really leading with that. And, the Answer Page founders, the Korns, Dr. Stephen Meredith, Korn and Stephen Korn, we're excited that they're going to be coming aboard our network and giving us really drill down information into the latest research on cannabis in a specific condition or disease state, research that they're pulling from some of the state data that they have access to. The reason why is because they develop content for Health and Human Services for several states and state associations on cannabis education that, by the way, is required by the states in order to have anything to do with cannabis from a physician or a pharmacist perspective. And guess what? They're coming aboard this network because they understand that full circle. Josh, you and I have talked about closing the loop on cannabis, right? And number one, keeping it legal. Number two, driving education. Number three, filling in the blanks with our network of people saying, hey, I have a question on cancer. I have a question on pain. So we've built the network of experts. And now we have an organization who is dedicated to the independent community pharmacy success and where we can tap into each other. With that, I want to welcome Heather Harrow with togetheRx. I'm so excited you guys are here.
Hi, friends.
Hey, Heather, how's it going? Hey, Todd, I want to make a mention that, the Cannabis Pharmacy Network is always trying to bring added value to its members. We represent over 700 community pharmacies, 23 states, I believe. And so one of my jobs as the CEO of the company is to constantly not just provide education and access to these products for the pharmacists, but to bring them other added values, things that can maybe help them outside of what we do every day for them. And so we're really happy to be partnering with Diversify and Lisa and Heather and the group over there, just because they're doing a lot to help the pharmacists be successful. We all know how tough it is out there right now for community pharmacists. And so we're happy to be bringing some additional resources as access to just better serve our pharmacists, our members, our future members, and just anybody out there that they can help. So really excited to be working with you guys.
So Heather, tell us about kind of the philosophy of the team at Diversify, led by Lisa, who has been a pharmacy owner for years, gone through helping to build the number one leading marketing organization that started off, 12, 15, 20 years ago through PDS, and was a pillar and developing programs. So that's been sucked into the PDS. It's like the next gen system and organization, coupling the minds of what's really working in community independent pharmacy. And now the subject of cannabis has come up. The subject of CBD has come up. We want our pharmacies to be cash-based opportunities, but we also want it to be backed by evidence-based study and education. So talk to us about kind of your philosophy in this.
Well, I am super happy to have learned from Josh and Steve at Cannabis Pharmacy. I'll tell you, we were talking for a long, long time building this partnership. It didn't just happen overnight. And not for any terrible reason. We just wanted to know more, know better. And what we've learned from Cannabis Pharmacy and the guys over there is that they care as much as we do. They're doing things like I was talking to Steve earlier, and he was talking about how when a law changed in North Carolina, one product was legal, one product wasn't. He drove there and completely exchanged all the product from the illegal to the legal after a legislative change. And I thought, wow, it's really the heart that we try and give independent pharmacy as well. And I love that about them. I love that they're willing to go the extra mile, not just to help our members. I mean, we all know that we love our members, but we love independent pharmacy as much. They give away free information and education, which I love. And you know that that's a big pillar of our, of our company, is to give this shit away for free. Right. And then really help them digest it and dial it down into strategies that they can then take into their pharmacy and replicate to get repeated success.
Yep. So for the network listeners, for people that are listening to DiversifyRx, and by the way, just as members of Diversify, you're a very strong breed of pharmacy owners with how much you've invested in your business to be able to go to a consultancy type, mastermind type organization and implement all of these strategies that are working. We're coming at this with extremely delicate pathways in making sure that it's real. So when I say education, when Josh and I and even Heather and the DiversifyRx talk about that, we're going to be developing education from sources that are already doing it, doing it for the states, already doing it for doctors and physicians to educate them on topicals and administration and disease state management and all of that. So this is not just a product opportunity in building business. This is an educational opportunity, and to pass that on to your patient too, which I think is key, because we're gonna be moving into the world. I want Josh, you to speak to this. The world's going to open up in the United States to a much bigger cannabis opportunity, and we want the public to know, if you have any cannabis in your system, if you're using it in any way, you should have a pharmacist involved in helping you understand how this is all working together, working with your allergies and your drugs that you're already on or something else, because it's not to be messed with. And it's a usable, extremely powerful opportunity to be holistic and combine pharmacology with holistic. And the pharmacist is key to that.
Todd, I can't tell you how many people I still meet today, 5, 6, 7 years after the Farm Bill, that still don't know that THC is legal to be sold to them without a card or a permit. We work in a number of states that don't have medical marijuana programs, or they're not easily accessible, or they don't meet the requirements. And so a lot of times we are the first or last stop for people to have access to cannabis products, and whether they're THC free or not. And so it's been a huge struggle to just, get pharmacists to understand what these products are, that they're safe, what to look for. And that's why we like working with groups like Diversify, because we know that they've taken a look at our company and the products that we sell and the educational platform that we have. And they know that we've been doing this for over 7 years and represent over 700 pharmacies, and that our sole focus is to make sure today we're educating. Tomorrow we have to educate. The legislation is going to change next year. We're going to keep having these conversations. And so being a source, a continued source of information and a place where people can go is so important. And so that's why, even with Heather's group and Lisa's group and Todd, your group, our group, the different associations that we work with, we tell them, say, hey, if you're looking for information, you want to learn more, pick up the phone and give us a call. Shoot us an email. I'm happy to give you as much information, as much samples, free stuff, like you say, Heather, right? Just to make sure that the people that have an interest or desire in learning more know that there's a place that they can trust to get it. And that's what's so important. So we thank both of y'all for being a part of that, because it does take a village for us to really make the impact that we're looking to make in the space and make people feel comfortable about what they're taking.
Yeah. And safe.
Yes.
And that's the thing. Think about this. Work together RX. We are forming a network that includes the member too. So if our Georgia state leader Marquez, Dr. Marquez, if he comes aboard and has something to say, if one of the members of togetheRx who is in Texas and they have special knowledge about something in one of the counties and they want to come on our news program, if someone from California is an expert in pain management and they want to team up with Dr. Mark Garofoli from WVU University on our network, like, this is the power of this network.
Yes.
This isn't just our three organizations. I mean, we're just the busy gongs and banging the drums, right? No, we're talking about building a network of pharmacist experts
Yep.
from a business perspective, from a legal perspective, and from an education perspective, an evidence-based perspective, to keep this network flowing and have a revenue source attached to it, which is very interesting. You can give a lot of good information away, but being able to actually make money in something, and have a business ideas of how to build that business in your community to become the highest quality of product available in your community, something that they can't get from Amazon, something it differentiates you as a pharmacy owner.
And Heather, we want to show all of our members how great you guys are. Can you tell some of the listeners out there just a little bit of some of the things that y'all help with some of the marketing strategy and provide? Because I know that we have a number of members in our group that would be happy to join. I know you guys are giving out a free 1-month full membership to anybody that want to kind of take a look at your program and see what y'all do to help them. Can you maybe give some of the listeners out there, some of our members, just an idea of some of the stuff that y'all may do for them, just to give them an idea?
Yeah, so it's not, so I personally, probably don't represent us well because I talk about marketing all the time, but marketing is a small portion of what we truly do. So we are a membership site. It is self-guided membership site where you can take actual courses and learn from compliance to team marketing, non-PBM revenue, PBM, how to optimize PBM revenue. So it's really creating a complete business within your pharmacy. This year, we are working towards creating pharmacy CEOs, and we believe that that's truly what pharmacists have to evolve in. Look, 20 years ago, I don't think that pharmacists really had to think about team building and being HR. They were mom and pop shops. But now we've evolved into where pharmacies, even small pharmacies, are having teams of 4, 5, 7 employees. And so we're helping them become pharmacy CEOs. Pharmacist is a role in a pharmacy. Traditionally the pharmacist has been the pharmacist and the CEO. We're trying to make pharmacy CEOs, and that's what our courses do. We have 4 levels of membership, all the way down from a paper. You don't get our orange envelopes every month. You don't know what you're missing, but this is our first level of membership. You get a literal written deep dive into one specific topic that goes all through. This is TikTok. I did a mastermind on using TikTok trends. The next level is our essential level. That's where most of our members will live, is our essentials model. That is a self-guided through our membership. However, with the essentials, you get the opportunity to call for help. I am a mastermind in another business group, and they call it asking for the fish instead of being taught to fish. So we will call us, we will give you the fish.
I like that.
We have our unlimited membership is everything in the first 2, plus you get unlimited coaching. And when we say unlimited coaching, we mean unlimited coaching. So we have several coaches. You can pick and choose if you wanted. I'm good with marketing and getting projects done, fundraising, things like that within your pharmacy. If you wanted a specific, I need to get this done, Heather, give me a plan and get it done. That's what I'm good at. We have a financials person. We have an all-around pharmacy coach. So we have that at your disposal. And literally, like, anytime. If you wanted to coach with 3 of us at one time, you can. If you need to talk to me every day for a week till we get this done, we can. It's that kind of unlimited. And then we have our inner circle, which is mastermind, or, our bigger mastermind. And that is closed at the moment. Our membership is closed at the moment too. It won't open back up until September. So you folks are, that get the free trial now are getting in under the Heather special. But our inner circle folks, they work one-on-one with Lisa. And then they get all the other, if they wanted to work with me or Mike or somebody else, they can work with them as well. So we have 4. Our biggest claim to fame is your success, is our success. We don't succeed until our pharmacy owners succeed. And we have worked tirelessly. We just redid our website, but we've worked tirelessly to be able to give you strategies that are easy to digest, easy to understand, easy for your team to understand, so that they can take the reins and get a lot of this done for you.
Heather, that's why I just realized as you were talking, why I was so drawn to your group, because y'all care. I have not met too many folks in the industry that just like really take that passionate thing about their members. A lot of the membership associations we talk about, it's pay me your dues, be a part of our program. But I really am drawn to the fact that you guys really take that passionate and follow through with the pharmacists. That's why I really am happy to introduce y'all to everything we're doing and people we touch, because it can be a big help.
Oh, thank you.
Thank you. I take pride in the organizations that I have on my network, and that's really the power of what I've built, is multiple people at every stage of the entire profession that we go after and we source for content that leads to actionable items. And that's where togetheRx comes in. They are actionable. And don't get me wrong, I love Lisa's podcast, but it's more than the content. Like, her content is more of just like a storyteller. She's inviting you to come in and join this group so that you can actually take action and actually see things transform and happen. And then, Josh, you're standing by as a source of so many things, not just the products that we can trust, but you're also delivering us this education by people that are doing it for state organizations, like state health and human service organizations. Like, that, I'm so proud of this. Like, this is an idea of someday I'm going to have this network of cannabis experts that we can trust. And that was way back in 2015. And like, here I am having Diversify freaking RX, be part of this, who is, in my mind, from, like I said, I've watched Lisa rise for the last, 10, 12 years. And it's just like this, it's a dream come true. It really is. So I'm excited.
Yeah. That's great. Yeah. Thanks, Heather. Any listeners out there that are wanting more information from Heather, reach out to Diversify. They're really awesome. I know that some of our members will take advantage of it. And if any other members out there that want cannabis information, we're always here for you too. Just reach us at cannabispharmacy.com or just give us a call. We're always here to help.
Yeah. And I want to just reiterate that we can take any pharmacy where they're at. You don't have to be making a certain amount of, filling a certain amount of prescriptions a day or making so much money a month. We can really help you at any stage of your journey that you're going to. So if you're in dire help, call and we can give you those fishes, get you out of there, and then we can start working on some of the other builders. If you're doing, okay and want some more opportunities, then we can help that person too. And then of course, the superstar entrepreneurials that, are just killing it in the world. Lisa will one-on-one with you and you guys will take it to the next level. So it's really any level of pharmacy.
That's great.
All right. Where should they go to get more information? They should go to linking up with you, Heather, or do you want them?
Yeah. So if you want to learn more information, always go to our website, togetheRx.com. If you want to take me up on the Heather special and get 1 month of free trial, email me, heather@togetheRx.com. And I will get you all set up. As I'm talking out loud, I got to make sure that all the links are working because our membership we close it down for certain. So we close it down for certain parts of the month to make sure that all the members that we did get in from the summit are onboarded correctly, that that they get the love that they need, that they're onboarded correctly, that they can add their team members, all of that fun stuff. So I'm letting you guys kind of sneak in, which is okay. Just Lisa's still on vacation, so I'm still taking all the liberties that I want.
That's
awesome.
Well,
yeah. So when she gets back, Heather may not be here anymore. So take me up on this offer.
It was the Heather Harrow offer. Hashtag.
Yeah.
All right. Yep. I appreciate you both. We're excited about this. Once again, check out diversifyrx.com. Reach out to Heather. Tell Lisa it's Heather's fault, and guys can move forward.
All right. Have a good day, guys.
Thanks, Todd.
Bye-bye.
See you next time. Stay tuned.